In the last section, we learned about the basics of cancer and how it develops in the body. Now let's focus on something more personal and practical. How to talk about our health, especially when we feel sick. Every person experiences illness in their life, whether it is a simple cold, the flu, or something more serious. Being able to describe your symptoms clearly is very important, especially when visiting a doctor or a hospital. Doctors cannot always see what is happening inside your body, so they rely on your words to understand your condition. If you can explain your symptoms in detail, you help the doctor make a correct diagnosis. In this section, we will learn key vocabulary for common symptoms like fever, cough. We will also learn words like diagnosis, medicine, and chemotherapy, which doctors use when discussing treatments. Finally, we will practice sentence patterns and look at a short reading passage to see how these words are used in real medical contexts. Remember, language is not just about grammar, it is also about communication. Being able to say, I feel tired or I have a fever in clear English can make a big difference in getting the help you need. Now, we will focus on words that describe symptoms and medical care. These vocabulary terms will help you to explain how you feel when you are sick and understand what doctors say about treatment. Let's read through the vocabulary one by one together. Let's learn about the pronunciation. Fever, cough, rash, fatigue, nausea, diagnosis, medicine, chemotherapy. You can repeat the words by yourselves one more time so that you are familiar with the pronunciation. Now we will look at the words one by one, check their definition, and see example sentences to learn how to use the words in a sentence. The first word, fever. It means high body temperature. Let's look at the 3 example sentences. I have a fever of 38.5 degrees. Fever is a common symptom of infection. Her fever went down after she took medicine. So next time you feel that your body temperature is rising than normal, you can say, I have a fever. Next, cough. Cough means sudden air coming from the lungs. The word can be used as a verb form or a noun form. Here, we're looking only at the noun form. Let's read the example sentences. He has a bad cough during the night. A cough can be a sign of the flu or a cold. The doctor gave her some medicine for her cough. So the GH here is pronounced as the F sound. Next, rash. Rash means the red spots or irritation on the skin. The child has a rash on his arms. Allergic reactions often cause skin rashes. She went to the doctor because her rash was very itchy. Itchy is the feeling that you have that you want to scratch your skin, and that's called itchy. Next, fatigue. Fatigue means extreme tiredness. Really, really tired. It's used as a noun form here. He feels fatigue after working long hours. Fatigue can be caused by stress or illness. Cancer patients often experience fatigue during treatments. So that means they get tired really easily. Next, nausea. It's the feeling you want to vomit, you want to throw up. Let's look at the example sentences. She felt nausea after eating spoiled food. Spoiled food means the food that has gotten bad. Next, chemotherapy may cause nausea. Nausea and dizziness are signs of stomach illness. Next, diagnosis. Diagnosis is the doctor's decision about an illness. You tell the doctor what symptoms you have, and then the doctor will make a decision that you have a certain kind of disease or illness. For example, he would say you have a cold or you have the flu. So that's a diagnosis. Now let's look at the example sentences. The doctor made a diagnosis after the blood test. A correct diagnosis is important for proper treatment. Early diagnosis of cancer increases survival rates. We talked about this in the last unit. Next, medicine. Medicine means the drugs you take to treat a disease. It can be in different forms. It could be powder, it could be liquid, it could be a pill or a tablet. Let's look at the 3 example sentences. I need to take medicine 3 times a day. This medicine will help reduce your fever. Some patients need strong medicine to control pain. And remember, there's a collocation here. You always use take to go with medicine. You take medicine. Next, chemotherapy. It's strong medicine used to fight cancer or to kill cancer. The patients began chemotherapy last week. Chemotherapy can cause fatigue and hair loss. That means losing your hair. Doctors often use chemotherapy after surgery. So it's a type of treatment. Now that we've learned the vocabulary, let's practice how real people might use these words when visiting a doctor or a pharmacy.